the pectineal line of the femur, which obviously is on the posterior aspect of the femur. So it's difficult to locate the insertion point of this particular muscle. The next muscle that we'll look at is the adductor longus. We need to locate the pubic tubercle, and then what we're going to do is palpate this muscle by using, once again, a flat palpation. This muscle runs down, longus means it's longer, and attaches onto the medial lip of the linea aspera. Once again, not really palpable from this position, but located on the posterior aspect of the femur. Then we'll move to the most superficial and most medial of this muscle group, which is the gracilis. And the gracilis has its origin on the inferior ramus of the pubis and the ramus of the ischium. This muscle runs down. We can actually use a pincer palpation on the proximal portion of this muscle. We'll trace it down as far as we can. We begin to lose the muscle belly. We'll use a flat palpation to continue to trace the tendon all the way down as it inserts into the medial proximal shaft of the tibia at the pes anserinus region. This is the only muscle of the adductors that crosses both the hip and the knee joint. We'll come back and now we'll look at a deeper muscle, which is the adductor brevis. And the adductor brevis originates on the inferior ramus of the pubis. We have to go through the pectineus and part of the adductor longus. This muscle runs down and also inserts into the pectineal line and the medial lip of the linea aspera, which is located once again on the posterior aspect of the femur. It's difficult to palpate. We're going to palpate through this and just try to locate the tendinous attachments of this muscle and see if we can feel the different fibers of that particular muscle. The final muscle, and the muscle that makes up the floor of the adductors, is the adductor magnus. The adductor magnus originates on the inferior ramus of the pubis, the ramus of the ischium, and the ischial tuberosity. So this muscle has attachments that run around onto the posterior aspect, onto the ischial tuberosity. This muscle makes up the floor of the adductors and is located in front of the hamstring. So if you're not sure if you're on that muscle, Leslie, can you pull your heel into the table a little bit and relax? So by contracting the hamstrings, I can feel the location of where the hamstrings are. I want to be anterior to that. And I'm just going to use a flat palpation to follow this large medial edge of the muscle. And we're going to trace this down. Now it dives underneath the sartorius, so we're going to lose it a little bit right here. And then we're going to come down. It attaches onto the linea aspera. And then it also attaches onto, right here, onto the adductor tubercle of the femur. So that makes up the adductor muscles, the 5 adductor muscles. Let's now take a look at one of the deep muscles of the posterior hip. We're going to palpate the attachment sites for the piriformis. First, we're going to locate the posterior superior iliac spine, the coccyx, the greater trochanter. If we draw a line between these points, this forms a T-shaped orientation. And that is the location of the piriformis muscle. This muscle is deep to the gluteus maximus, and we're going to palpate this origin by locating it. It starts and originates on the anterior surface, which is deep to where we're palpating. Right along here, this is the lateral aspect of the sacrum, so tucked behind and anterior to this is where the piriformis begins. We'll use a flat palpation through the thick and large gluteus maximus muscle as we make our way across the body to the insertion point right here on the greater trochanter. You can feel part of that tendon if we strum across it. Now we're going to take a look at one of the deep six muscles called the piriformis. So to palpate this muscle, it originates onto the anterior surface of the sacrum and then inserts into the posterior aspect of the greater trochanter. We're going to palpate with a flat palpation and move deep into the tissue to move across, once again, the muscle fibers of this muscle as we trace it from midline to the lateral aspect of the hip. Right approximately here we lose the muscle belly, so this is tendinous. This is the tendinous aspect of this muscle as we continue our way to the insertion point onto the greater trochanter located here. This muscle is a strong external rotator of the hip. Now we've changed position. We placed Todd into a sideline position, and we're going to palpate the iliacus and the psoas, collectively called the iliopsoas muscles. We're going to locate first the anterior superior iliac spine. We're going to trace upward along the iliac crest. We're going to feel towards the midline of the body for the inguinal ligament. We want to be superior to the anterior superior iliac spine and the inguinal ligament. We're going to slide into, we're using the fingertips, we're going to slide into the iliac fossa, which is the origin for the iliacus. And Todd, is that pressure okay?
Yes.
The fingers are tilting back upward into the fossa to palpate the muscle fibers. This muscle's difficult. We can't palpate the entire thing, only portions of it. And if we're not sure if we're on it, I'm going to ask Todd to just gently bring his knee into my hand and relax. I can feel the muscle fibers contract underneath my fingers. I'm going to slide inward just a little bit more. Is that depth okay?
Yes.
And just move my fingers gently across the muscle fibers of the iliacus. This muscle runs down and inserts into the lesser trochanter of the femur. Now we'll move towards the midline of the body, and we're going to palpate the iliopsoas, which originates on the bodies and transverse processes of the lumbar vertebra. So in order to palpate it from this position, we're going to find the lateral margin or border of the rectus abdominis. We're going to slide in using the fingertips, just gently moving the viscera out from under our fingers, and we're going to land on top of the muscle belly of the psoas.
Bones back again. Just wanted to talk to you about this very sensitive area. Palpating the psoas and the iliacus, it's really palpating through the abdominal region, and most people are either ticklish or just plain sensitive here. Your depth of pressure is quite critical. Get feedback, talk to your partner, and just have fun with this palpation as you feel the muscles below.
And just to confirm that, can you just gently try to bring your knee towards and relax? And I can feel the muscle contract underneath my fingertips. I'm going to slowly come out of this area. Once again, a very sensitive area to palpate. So we want to communicate with our clients. I'm going to move into the upper portion of this muscle. And bring your knee up slightly. I'm going to resist it just a little bit. There we go. In this position, we have to load the muscle, load the leg a little bit so the muscle pops out a little bit more. And that's about the top portion of the psoas on Todd. We can come inferiorly and we can palpate still another portion of that muscle belly just superior to the inguinal ligament. Same technique, just moving in a circular motion back and forth down onto the muscle belly, and bring your knee and hip up and relax. You must resist it. There we go. So we can feel the muscle belly and the muscle fibers of the psoas here. This muscle also travels down and inserts onto the lesser trochanter of the femur, which is on the medial superior aspect of the femur. Now we're going to take a look at the insertion point for the iliacus that we palpated up here. So anterior superior iliac spine. You can feel across the inguinal ligament, the sartorius that we talked about earlier. The sartorius, the inguinal ligament, and the adductor longus form what's referred to as the femoral triangle. In the femoral triangle, we have the inguinal lymph nodes, the femoral artery, nerve, and vein. So we just want to use this as our reference point. We're going to feel for the femoral pulse. We want to make sure that we are medial to that so that we're not on those vascular structures. And now we're going to palpate for the very thick and tendinous adductor longus and or gracilis. We're going to move medial to those. We're going to feel for the greater trochanter, and we're going to slide towards the table and in towards the midline. And we want to make sure we have good communication. Again, is that pressure okay, Todd? And just to confirm that I'm in the right place, I'm going to ask Todd to flex his hip up and relax, and I can feel the tendinous attachment from the iliacus, which runs off the iliac fossa down underneath the inguinal ligament and inserts into the lesser trochanter. We also have the psoas, which runs off the anterior bodies and transverse processes of the lumbar vertebra, makes its way down, and also inserts into the lesser trochanter of the femur. The pelvis and thigh region requires a tremendous amount of sensitivity. This is an area where less is truly more in regards to pressure. The ability to communicate with your client is extremely important when attempting to locate the muscle bellies and tendinous attachments of the pelvis and thigh.